What are the withdrawal symptoms of PTSD sleep aids? Imagine finally feeling like you can get some rest after struggling with nightmares and insomnia, only to face a new challenge when stopping sleep aids. Many medications prescribed for PTSD, like benzodiazepines and non-benzodiazepine sedative hypnotics, can help with sleep issues but may lead to dependence if used long-term. When someone suddenly stops these drugs, withdrawal symptoms can appear, and they can be quite uncomfortable. It is especially important to understand this process because PTSD itself already involves sleep disturbances, anxiety, and emotional ups and downs. Withdrawal symptoms from sleep aids can vary depending on the medication type, how long it has been used, the dose, and individual differences. Common symptoms include increased anxiety and even panic attacks as the calming effects of the medication fade. Many people notice their sleep problems returning or worsening, with difficulty falling asleep or staying asleep, which can be more severe than before they started the medication. Physical symptoms often show up as sweating, trembling, nausea, vomiting, headaches, dizziness, rapid heartbeat, or feelings of palpitations. Mood changes are also frequent, with irritability, agitation, feelings of depression, or mood swings. Some individuals may experience cognitive issues like confusion, memory lapses, or trouble concentrating. In rare but serious cases, especially with abrupt stopping of benzodiazepines, seizures can occur, which makes medical supervision crucial. The timeline for withdrawal symptoms usually begins within hours to a few days after stopping the medication. Physical symptoms tend to peak within the first 2 weeks, but psychological symptoms such as anxiety, depression, and sleep difficulties can linger for weeks or even months. This prolonged phase is sometimes called post-acute withdrawal syndrome. For those with PTSD, withdrawal can be particularly tough because it might worsen existing symptoms like hypervigilance, nightmares, and emotional instability. The quiet of nighttime can make withdrawal symptoms feel even more intense, leading to increased anxiety and restlessness, which can make sleep even harder to achieve. It is very important to emphasize that stopping sleep aids suddenly or without medical guidance can be dangerous. Healthcare professionals can help create a gradual tapering plan to reduce the medication dose safely, which helps minimize withdrawal symptoms and lowers the risk of complications. Support from medical providers is also vital for managing the emotional and psychological effects of withdrawal, especially in PTSD, where emotional regulation and sleep are closely connected to recovery. Practical steps to ease withdrawal include maintaining a calm sleep environment, avoiding caffeine and alcohol, and sticking to a consistent sleep routine. However, these are supportive measures and should always be used alongside professional medical advice. In summary, withdrawal from sleep aids used for PTSD can involve a range of physical and emotional symptoms, which may temporarily worsen sleep and anxiety issues. Because of this, medical supervision is essential to ensure safety and comfort during the process. Always consult a healthcare provider before making any changes to medication routines, especially when dealing with complex conditions like PTSD. Remember, each person's experience is unique, and professional guidance helps tailor the safest and most effective approach for recovery.